Back again, it's Levi here, part 3 of our series, talking about depression. I'm here with a very special guest. I'd like to introduce you to Gary Roberts. Gary is a psychologist. He's going to explain to you a bit about his role, and we're just going to have a bit of a discussion about depression and how psychology fits into the whole theme of depression and how it's used as an intervention. It's my favorite intervention, and I'm sure you guys can relate to it as well. Yeah, so we're just going to ask Gary a few questions about who he is and what his role is as a psychologist. So over to Gary. Gary, can you tell everyone what it is that you do? You're a psychologist, but what is your role as a psychologist, first and foremost?
Okay, there are, I suppose, a couple answers to that question. So in terms of my overall role, I am responsible for the psychology service in the acute part of Birmingham and Solihull Mental Health Trust's provision. And by the acute service, what I am referring to is those people who are so unwell that they have to be hospitalized for a brief period of time to respond to, I suppose, help them to recover so that they can be very quickly returned to the community. So I oversee the psychology provision in that part of the service. The other part of my job, which is as a psychologist per se, as in somebody who sits in a room with service users or people who are psychologically unwell, that is based on the premise. Well, one of the premises that is based on is the idea that regardless of how unwell somebody might be, if you take the time to sit and talk to them and to understand the context of their life, to understand their life experiences, sometimes from the moment of birth, the family background they come from, the life experiences that they've had, the trauma that they've experienced, you're able to actually make quite useful sense of what they're going through, why they're feeling the way they're feeling, and get a sense of potentially what would be the best way forward for that individual. Now, I would say that this differs from what a psychiatrist would do, in that while we are aware of diagnostic labels such as to say that somebody has schizophrenia or to say that somebody has X or Y, we're aware of those labels, but we tend not to be influenced hugely by those labels.
Yes,
So
yes.
what I mean by that is, if you were to say that somebody is psychotic, then if you are medically inclined, that would mean that because they're psychotic, there are a number of medications that you need to persuade them to use. And so medications that work with psychosis as opposed to medication that works with anxiety, or medication that works with some other diagnostic category. The psychologist looks at the person. We will be aware that the person has a particular diagnostic label, but what we would try to come up with, working in collaboration with the person, is a sense of how they got to the point that they are, what are the circumstances that influence them, and what changes based on that understanding are likely to move their lives in a more positive direction. I'm oversimplifying it, but
definitely.
sometimes I think it's really important to establish the difference between psychology and psychiatry. We work together.
Yes.
So it's not one being better than the other, but
yes.
both approaches used collaboratively can reap huge benefits to somebody who is in psychiatric stroke psychological distress.
Fantastic. There you have it. A great summary of how psychology fits into this whole ethos of care and supporting people in acute crisis through depressive episodes. But what's important to understand is that the psychologists and us as professionals, we're very much interested in the context of the episode. And as Gary just touched upon, the psychologist is interested in you as an individual, in your story, and how that has sort of led to where you are today. If it has influenced your family background, your history, your experiences, all of these are important. So discussing these and learning how to open up is something that the psychologist is very, very good at. So you wouldn't have to necessarily worry about your lack of ability to communicate or to open up. Am I right in saying that the psychologist would help in that regard?
Yeah, I mean, we're trained to facilitate communication. We understand that for a lot of people, experiencing mental disturbance is quite terrifying. There's a lot of stigma attached to it. And the last thing that people would want to admit to themselves, first of all, is that they have a problem because of the potential ramifications that could go with that, of being thought to be, crazy. And also, it's a really scary experience where you feel like you're losing control of everything that previously you would have been able to manage in terms of your life. So we're trained to take all those things into consideration, to take our time to make it as easy as possible for people to begin to tell their story. But I suppose one point that I'd like to make, if we're talking about depression specifically, is that from a psychological point of view, there's been a lot of research done, and they've identified that people who experience quite profound depression, to the point sometimes of maybe even thinking of ending their lives, at the core of depression is the belief that the person has lost complete control over all the things that are important in their lives, that bring them pleasure, satisfaction, financial rewards, emotional connection to family, to the world. So for whatever reason, this person has come to believe that they've lost all control over the possibility of having those things, and there is absolutely nothing that they can do that will ever allow them to be able to experience those things. So it's what we're talking about is a belief system, a belief that a sort of belief in helplessness and hopelessness. Yeah. And where talk therapy would come into it would be, first of all, to help the person to realize that that is what's going through their mind. Because when you're in the midst of that kind of crisis, you're very aware of the emotional reaction that you're experiencing. But you tend not to be able to think clearly and to actually realize that it's a pattern of thinking, it's a conclusion that you've come to that actually gives rise to that sense of hopelessness, which then gives rise to the depression. So what psychology would attempt to do is to really understand what experiences you may have had that has actually led you to the belief that you can't control positive things in your world, and you give up the hope. So helplessness, hopelessness tends to be what almost inevitably, not almost actually, 100% of the time tend to be at the core of depression.
Wow.
So the work within a psychology session would be to be able to challenge with you the belief that things are as hopeless. And even if your life circumstances are really quite difficult, then part of that process will be with you to work out what are the changes that you need to be helped to make. And it could be something on the very basic level of how do you feel financially safe? How do you secure accommodation? How do you escape from a relationship where somebody is being very controlling and being very abusive? What are the actual real world things that need to be put back into your life so that you can once again have a sense of being in control? So I don't know how clearly I'm putting
That's
that
very
across.
clear. So identifying, and psychologists will have to identify some of those things that are going on that aren't necessarily at the forefront of the mind.
Yeah.
And it's about exploring that and looking at to what extent those issues are impacting on someone's life. We spoke in previous videos about the biopsychosocial model of care. And sometimes it could be something like chronic illnesses. It could be social factors, as Gary just touched on, a poor relationship.
So loss of control of your physical health,
Yeah.
which can mean that maybe you were an athlete and all of a sudden your body isn't able to do the things that have defined who you are.
Yeah.
Maybe you've been quite quick-witted, very bright, and then all of a sudden you aren't being able to think as sharply.
Exactly. Yeah. And those would have a profound impact on somebody's life. So we've spoke to Gary. Gary's here on our team, fighting in our corner. He's a lieutenant in the game, in this army.
Not a field marshal.
Not a field marshal. He's a lieutenant in our army and in our fight against depression. There's people like Gary, people like myself, and many others that are here and committed to this cause. So the point is, do not feel alone. Stay with us. There'll be more context. If you've enjoyed it, like and subscribe. Leave a comment, ask questions, and hopefully we can answer some of these questions in future videos. It's been a pleasure speaking with you guys. Signing out. You take care.